Hi friends, welcome to Physiodemic. Today in this video, I will tell you about the cervical radiculopathy. Okay, so first we'll discuss about the definitions of cervical radiculopathy. So cervical radiculopathy is a disease process due to nerve compression from herniated disc and arthritic bone spur. Okay, so impingement produces pain, numbness, sensory deficits, and motor dysfunction in the neck and upper extremity. So then we will discuss about the etiology. Now I will tell you about the etiology. So cervical radiculopathy is a dysfunction of nerve root in cervical spine. So it can affect people of any ages and most prominent in between the 40 to 50 years of ages. So two mechanism of nerve root impingements are there. First is spondylosis leading to the stenosis and bone spur formations, which is common in older patients. The second is disc herniations, which is common in younger patients. So nerve root compressions and the cytokines released from the damaged intervertebral discs causes pains and cervical radiculopathy. So most common level of root compression is C7, followed by C5 and C6. So intervertebral disc decreases in size from upper cervical spine to lower cervical spine. So now I will tell you about the clinical presentations. So typical symptoms are irradiating arm pains in dermatomal pattern, paresthesia, muscles weakness in myotomal patterns, reflex impairment, headaches and scapular pains, sensory and motor dysfunction in neck and upper extremity. So symptoms increases with side flexions towards the painful side and also with extension and rotations of the neck, and these extensions and rotations of the neck causes reduce in the size of intervertebral foramens. Okay, then I will tell you about the differential diagnosis, and these are spinal tumors, cervical myelopathies, ligament instabilities, vertebral artery insufficiency, peripheral nerve disorder, thoracic outlet syndromes, and brachial plexopathy, etc. Now I will tell you about the diagnostic procedure. So the most common method used to assess the presence of compressions are X-ray, MRI, and CT scans. And in MRI, the root compression is seen, but to detect the foraminal stenosis due to bony compressions is detected by CT scan. A subjective history and mechanism of injury should be considered for an accurate diagnosis. Now I will tell you about the examination and special tests. Okay, so the provocation tests are performed to provoke the symptoms. As for one research, the 4 clinical tests okay, are there to provoke the symptoms. When combined, it holding the high diagnostic accuracy, and these are Sporling test, upper limb tension test, distraction test, and cervical rotation range of motion test. Okay, so when all the 4 of these clinical features are present, then the probability of cervical radiculopathy is 90%. When 3 of these are positives, the probability reduces to 65%. Now I will tell you about the medical management. So there are several intervention strategies are there to manage the cervical radiculopathy, but physiotherapy and surgical intervention are the most common methods. Okay, so now I will tell you about the indications of surgery. So these are radicular pain, then paresthesia in involved nerve root dermatomes, motor deficits, reflex change, a positive response to selective nerve root compressions, then a positive response of MRI and CT scans, then failure of conservative cares like physiotherapy, injection therapy. Okay, and the techniques of surgeries, surgical managements are anterior cervical dissection, then anterior cervical dissections with fusion, bony fusion, laminotomy, foraminotomy, and corpectomy. And the injection procedures are transforaminal epidural steroid injection provided relief to almost 60% of the patient. Now I will tell you about the physiotherapy management. In physiotherapy management, I will first tell you about the manual therapy. Different techniques are used, but most common methods are passive accessory intervertebral movement, passive physiological intervertebral movement, natural apophyseal glide, and sustained natural apophyseal glides techniques are used. The second is the exercise therapy, where the active range of motion exercise, stretching and strengthening exercise is taught to the patient. And third is the postural re-education is taught to the patient. Then muscle energy techniques and neurodynamics techniques is also used for the treatment. When manual therapy is combined with exercises, it gives more beneficial to reduce the pains and to improve the functions of the improve the function of the patients. And manual therapy techniques has no significant additional benefits compared with one another's, and the manipulations provide short-term pain reliefs. So when mechanical tractions and exercise is combined, its result in lower disability and pain at long-term follow-up. So according to one research in 2011, thrust mobilization of thoracic spines and non-thrust mobilizations of cervical spine is effective at reducing pains, improve the functions, and increase joint range of motions. So strengthening exercises to perform to perform to increase the stability, reduce the risk of developing the nerve root irritations, and also interscapular strengthening exercises and DNF activations.